This is like TV network.
The Honorable Minister of Health or representatives who are present, honorable members of the Grand Gedeh Legislative Caucus here present, the Director of Community Health or representatives here present, to the Honorable Acting County Superintendent, our traditional leaders, distinguished professional police, ladies and gentlemen, all protocol duly observed. Firstly, I would like to thank our Honorable Grand Gedeh County Health Officer and our last mile health leadership here in Grand Gedeh County for hosting this handover ceremony. I am honored to be standing before you on this historic day to say a few words on behalf of Last Mile Health Leadership team, and I am also bringing heartfelt greetings from Dr. Marion K. Suba, Country Director of Last Mile Health, who cannot attend due to health reasons. Looking back from the start of this journey, Last Mile Health celebrates about 17 years of selfless service in Grand Gedeh County in partnership with the Grand Gedeh County Health Team and the Ministry of Health. Let's talk about some of the things that were accomplished, and I think you have seen a lot from previous speakers and have also seen the video. But I just want to emphasize a few things. Always centered in our mission to save lives, we started our health program in Grand Gedeh at the Martin Tubman Memorial Hospital. At the hospital, we launched and operated the first antiretroviral treatment clinic and recruited, trained, and deployed community health workers, volunteers for a couple years to provide home-based care to people living with HIV/AIDS. This approach was aimed at reducing stigma and discrimination associated with HIV/AIDS and to increase client retention and treatment adherence. In partnership with the Ministry of Health, Last Mile Health piloted its community health worker program in Congo in 2012. This project sought to impact maternal and child health outcomes, informing the government and NGO stakeholders ahead of a planned national scale-up of the community health worker health services delivery for remote communities. With the emergence of the Ebola virus disease in 2014, Last Mile Health collaborated with the Ministry of Health to train 1,300 community health workers in the detection, prevention, and reporting of cases. As a result of this great work, the county did not experience the devastating impact of Ebola, unlike other counties in the Southeast. Let's appreciate our heroes and heroes with a hand of applause. Encouraged by the results obtained from the Congo pilot project and the work of the CHWs during Ebola, the National Community Health Assistance Program was designed and launched by the government of Liberia in 2016. Today, there are more than 5,000 community health assistants and community health service supervisors working to deliver primary care in all 15 counties. Grand Gedeh can take pride in helping to create that blueprint. Since Grand Gedeh was the first county in the national program, Last Mile Health has long planned to transition management of the program to the county health team. Because this program is truly a government program and should not be dependent upon an NGO partner for more than 15 years. In 2022, Last Mile Health delayed not operating. LMH responded to an urgent appeal from the Ministry of Health and absorbed all the CHWs in those districts, which significantly increased the CHSS from 4 to 25 and from 63, the CHAs from 63 to 218. Last Mile Health retrained some of the CHAs, equipped and supplied medical and non-medical commodities, supported quality supervision by CHSS, and paid monthly incentives. Over the years, Last Mile Health provided technical support for the capacity building of the CHD staff through its health system strengthening sub-project. The leadership and governance structure, such as the health boards and program quality review meetings, have now been implemented. All of this was made possible by working with a wonderful team of last milers and dedicated professional health workers at the Grand Gedeh County Health Team, who gave their best to ensure that the community health program succeeded. Let me say that when the story is told, there is no way Grand Gedeh County will not be mentioned for its contribution. The seed that was planted, as the previous speaker has said, has now gone beyond the boundaries of Liberia and is now into other countries. That is something we can all be proud of. Last Mile Health is confident that the Grand Gedeh County Health Team has built the required human resource capacity to manage the delivery of quality community health services when access to other resources is provided by the government and its partners, as well as the community served. I want to take this time to reaffirm Last Mile Health's commitment to continue to provide technical assistance to the National Community Health Program and to advocate for some continuous funding for the implementation of the Community Health Program here in Grand Gedeh. LMH also recognizes the logistics needed to successfully conduct activities such as restocking and adequate supervision of the CHA. Therefore, Last Mile Health will be handing over several assets to the Grand Gedeh County Health Team through the Ministry of Health to ensure that the ministry has what it needs to successfully maintain the program. Madam Minister or her representative present, without further ado, I now hand over the Grand Gedeh Community Health Program to the Ministry of Health through the Grand Gedeh County Health Team. Thank you.
She is still Deputy Director for Administration at the Last Mile Health. Thanks so much for watching. My name is Lord Fallon. This is Liberian TV Network.